Hi all, my name is Emily Epearson and I am a licensed vocational nurse and a student at California State University, Long Beach. This is my anti-drug infomercial for my Drugs and Health course, HSE 427. The infomercial will focus on anabolic steroids. The pictures you see on this slide are of popular Instagram fitness models. Fitness has become a very important subject in today's society. It seems everyone out there is in pursuit of their best health. For some, this means a very toned and muscular physique. Some people use social media to document their progress on their fitness journeys for all of the world to see. Most fitness models on Instagram use good old-fashioned diet and a strict exercise regime to achieve their desired results. But there is a drug that people have been turning to since the 1930s to boost their fitness results, increase their muscle mass, and reduce their body fat. Individuals with the behavioral disease muscle dysphoria are more likely to use anabolic steroids. These men and women think they look small, weak, fat, and flabby when they are actually large, lean, and muscular. Anabolic steroids are synthetic hormones very closely related to testosterone. These hormones have an effect on skeletal muscle growth and aid in the development of masculine secondary sex characteristics like facial hair and deepening voice. Due to these characteristics, the proper name for anabolic steroids are anabolic androgenic steroids. However, most people know of them as anabolic steroids. These drugs were invented in the 1930s to treat low testosterone in young men who did not naturally produce enough testosterone to have a puberty and develop normally. This condition is known as hypogonadism. Shortly after this, bodybuilders and weightlifters as well as athletes discovered that this drug enhanced their athletic performance and the abuse of steroids began. Most people obtain these drugs through mail orders from countries who sell them over the counter without a prescription. Steroid abusers have different methods of dosing. The three most popular methods are cycling, stacking, and pyramiding. Cycling involves taking the drug for a period of time and then stopping and later restarting. Stacking involves taking several different preparations of steroids, including injectable, oral, and veterinary preparations, in search of a synergistic effect that has not been scientifically proven to occur. Pyramiding is the most complicated of steroid dosing regimes. When using the pyramid method, users start off on a low dose of steroids and work their way up to very high doses, and then taper back off to nothing over a 6 to 12-week period. Users believe that this method helps the body's endocrine system tolerate high levels of steroids while providing time for the endocrine system to recover from the shock of steroid use. These claims, however, are scientifically unfounded. It is important to note that when used for illicit purposes, anabolic steroids are dosed at anywhere between 10 to 100 times higher than what a doctor would prescribe for a health condition treatable with them. All drugs come with a risk of side effects. Often these side effects are undesirable. Some of the short-term side effects that come with anabolic steroid use are paranoia, irritability, impaired judgment, and mental instability. Users may also have extreme mood swings of anger that increase the likelihood that they would become violent. Steroids do not trigger a release of feel-good chemicals, so users do not experience a high when using them. However, long-term use can disrupt natural serotonin and dopamine pathways in the brain that affect mood and behavior. Despite the fact that the drugs do not produce a high, some users may exhibit clinical signs of drug addiction to steroids, such as spending a lot of time and money obtaining the drugs and continuing their use despite experiencing side effects. This is a risk that must be taken under consideration as addiction is possible. Contracting a bloodborne pathogen like HIV or hepatitis B or C is a risk when using this drug, as some forms of it are injected, often in public places, and needles could be shared. Some of the side effects of steroid use can persist after stopping. These permanent side effects are sex-specific. Males can expect increased prostate cancer risk, baldness, male breast development or gynecomastia, decreased sperm count, shrunken testicles, and females can expect facial hair or excess body hair, male pattern baldness, menstrual changes, clitoris enlargement, and deepened voice. Steroids are powerful hormones, which are chemical messengers that have the potential to disrupt multiple body systems. An individual's stroke risk increases with steroid use, as steroids can cause cardiomegaly, high bad cholesterol, low good cholesterol, and hypertension. Steroids also affect collagen synthesis, putting users at an increased risk of tendon rupture. With a laundry list of unattractive and dangerous health side effects, let's look into some alternatives to steroid use. One of the most important is to set realistic fitness goals for yourself. Rome was not built in a day. It could take months or years to get to your best you. You may never look like the fitness model or athlete you idolize because you are you and they are them. The only person you should be comparing yourself to is former versions of yourself. If you feel that you may be dealing with some body dysphoria, counseling and treatment may help. Having patience and not trying to rush or microwave your fitness results is also important. Making sure you are getting a balanced diet with protein, carbohydrates, and healthy fats will help your body build the muscle it needs when working out. It is also important to just have fun doing what you are doing. Everything does not have to be a competition. Make sure you are enjoying what you are doing along your fitness journey. This concludes my anti-drug infomercial on anabolic steroids. Thanks for watching.